I'm Alenka Daniel, I'm Communications Manager at Barts Health NHS Trust.
I'm Andy Foster, I'm the Digital and External Communications Lead at Northamptonshire Healthcare.
3 of our teams use Vocoll, 2 of them external on our website and the other one internal.
So we currently have 2 installations of Vocoll. One we're using in CAMS. We've branded that under the CAMS Live heading, and we're also using it within our 0 to 19 admin hub.
So our external teams that are using it are our appointments team, so they use it to change, reschedule and answer any questions that patients might have about their outpatient appointment. The maternity team use it, and that is mainly for their first scan appointments and booking and any questions they have about their birth or their labour. And then thirdly, the internal team it's placed on our intranet, and that is a go-to option for our staff to answer any questions that they may have about using our intranet and where to find things.
In CAMS, we're using the product as part of CAMS Live, and this is really about young people taking the first step to say, I need some support with my mental health. And usually people don't know what support they need, they just know they need some support. So CAMS Lives allows them to connect straight with our administrative team in CAMS, and there's clinician support in that team as well. And they will work with the young person and talk to them over the live chat to understand what their needs are, and where appropriate, put a referral through into CAMS itself, or more often than not, it might be that they don't meet the threshold for CAMS, but they can have the early intervention where they then put a referral through to a voluntary and community sector service. So actually that young person is getting the early support they need, and hopefully will never progress into needing a CAMS referral.
A lot of our generation now, or particularly my generation, want everything here and now. They don't want to call someone up on the phone. They don't want to email someone. They want to speak to someone right there and then, as they would on social media. So I do think that it's improved the accessibility of those services, which people want to try and access every day, and then improves the service. When we use it for our intranet, the general culture around the intranet is you can't find anything. However, when you just help someone and say, well, actually it's on this page, it reinforces the fact that actually the internet is a very helpful tool to use. So it is helpful for our internal teams, but also for the appointments team. They've actually told us that it's reduced the amount of calls that they have. And also Vocoll gives you the opportunity to put in a satisfaction rating. So the fact that patients can say, yes, this query was answered, or no, allows them to understand what kind of things they need to improve on in their service anyway. An instance with the appointments team where there was an issue with a patient and their care or their appointment, you know, having that transcript there to fall back on if there was any issue is really helpful. I think it kind of brings the NHS more into the modern world. A lot of people think the NHS is a little bit archaic. When you go onto a flight website like Ryanair, it's the first thing that you do. You can go and speak to a chatbot, so why isn't the NHS the same? So I think installing chatbot is something that can kind of challenge that. I also find the system quite easy to use. It's very easy to set up teams, set permissions, restrictions, etc. If you're not using chatbot now, I would say you should do within the next year, because that's generally what everybody else will be using.